What is the UVGI dose response curve for TB? The ultraviolet germicidal irradiation dose response curve for tuberculosis describes how effectively ultraviolet light can inactivate the bacteria that cause tuberculosis. This curve illustrates the relationship between the amount of UV light exposure and the reduction of Mycobacterium tuberculosis in the air. The UV dose is measured in microseconds per square centimeter, which combines the intensity of the UV light with the time it is applied. As the UV dose increases, the effectiveness of inactivating airborne TB bacteria also increases. This relationship is often represented as an exponential decay. In simple terms, as you expose the bacteria to more UV light, the number of surviving bacteria decreases rapidly. A key factor in this curve is known as the z-value, which indicates how susceptible TB bacteria are to UV light. The z-value is calculated based on the ratio of bacteria that survive without UV exposure compared to those that survive after being exposed to UV light, divided by the UV dose. A higher z-value means that the bacteria are more susceptible to UV light, leading to quicker inactivation at lower doses. Research shows that to effectively inactivate TB bacteria, UV doses typically range from tens to hundreds of microseconds per square centimeter. For instance, studies have demonstrated that with the right UV dose, up to 90% of TB bacteria can be inactivated in areas where patients breathe. The dose-response curve can be expressed mathematically. The initial number of viable bacteria is represented as N0. After applying a certain UV dose, the number of surviving bacteria is represented as NUV. The equation shows how the number of surviving bacteria decreases exponentially with increasing UV dose. However, the effectiveness of UVGI is influenced by environmental factors. Things like air circulation, humidity, and the positioning of UV lamps play a crucial role in how much UV light the TB bacteria actually receive. In practical terms, upper room UVGI systems are designed to ensure that sufficient UV doses are delivered in the upper air of rooms. This helps inactivating airborne TB bacteria and reduces the risk of transmission. The dose-response curve is essential for designing these systems to ensure they provide enough UV exposure for effective disinfection. In summary, the UVGI dose-response curve for tuberculosis is characterized by an exponential decay that highlights the relationship between UV exposure and bacterial inactivation. Effective TB control requires delivering adequate UV doses, particularly in the germicidal wavelength range, to significantly reduce the presence of TB bacteria in the air. This scientific understanding guides the implementation of UVGI systems as a vital public health measure to prevent the spread of tuberculosis. Always consult healthcare professionals for personalized advice regarding tuberculosis prevention and treatment.